This is a Chronicle podcast, bringing you ideas in the service of medicine.
From the Chronicle podcast system, this is a Skin Spectrum podcast. It's Yadav on Acne, with Dr. Geeta Yadav. Based on recent publications from the clinical literature, Dr. Yadav provides brief synopses of recent significant clinical developments in acne research, and provides her observations and comments to accompany each report. In each episode, Dr. Yadav will answer questions and offer her expert observations and anecdotes on treating this disease. If you have a question for Dr. Yadav or want to be in touch at any time, just send an email to yadav@chronicle.org. That's YADAV@chronicle.org. And, if you attach a voice clip, we might even use your question on an upcoming episode. Support for this podcast comes from Cipher Pharmaceuticals. Cipher is a specialty pharmaceutical company with a robust and diversified portfolio of commercial and early to late stage products. Cipher currently markets dermatology products directly in Canada and indirectly through partners in Canada, the US, and South America. Visit them at cipherpharma.com. And now, here's John Evans.
Thanks, Leona. Welcome to the Yadav on Acne podcast with Dr. Geeta Yadav. I'm John Evans of the Chronicle of Skin and Allergy. In the final episode of this season, Dr. Yadav will be addressing the topic of treating the sequelae that can emerge after acne or its treatment. Our first study is a review of the literature on treating post-acne erythema. The authors conclude that both laser and topical treatments are effective for these lesions, but there needs to be more research. Welcome back, Dr. Yadav. What are your thoughts on this paper?
Thanks, John. It's wonderful to be back and to be talking about this topic again and moving us forward to now thinking about the sequelae of acne and what we can do with it. So this is a great review, a systematic review of all the literature on common sequelae of acne inflammation. What came out of it was sort of unsurprising, I think, for many of us who treat acne, scarring, acne, post-inflammatory erythema, post-inflammatory hyperpigmentation. Generally, laser therapy was viewed as highly effective, pulse dyes being the most common kind of laser used. ND-YAG lasers also were commonly used and effective in treating post-acne erythema. Topical treatments that were suggested include oxymetazoline, tranexamic acid, and brimonidine. And these are promising, but I do note that they are temporary. And so when I see patients for post-acne erythema, I think I'm looking at the short term and the long term. And it's important to be noted that often where we are doing these treatments is the face, though acne can affect the chest and the back and other areas too. There is a lot of forgiveness in the healing of the face. And I do find that the post-acne erythema to some degree will improve independently over time. And I do tell patients that when they're, say, completing their treatment for oral isotretinoin, that the redness will be the last thing to fade if it's going to. And so I think it's important to give patients a little bit of that context, in addition to being able to provide them with alternative treatment options.
Our next study compares microneedling plus topical vitamin C to microneedling plus topical insulin for treating atrophic acne scars. What's your take on this study, Dr. Yadav?
So I think this is a really neat paper. The authors did a split face study using a vitamin C with microneedling versus topical insulin with microneedling. So using microneedling for assisted delivery of these two sort of quote unquote drugs. The insulin story is neat because insulin is a potent factor for wound healing, and it's been reported to induce rapid recovery in various wounds. It is believed to induce collagen formation as well as new blood vessel formation in healing tissues via TGF-beta1 and VEGF. So it has the potential to be a novel topical therapeutic in the dermatologic space. In this study, the split face study, there was slightly more improvement with the vitamin C plus microneedling side versus the insulin microneedling side, but both showed efficacy and benefit when it came to looking at different types of acne lesions like ice pick, boxcar, rolling, and mixed scars. and in male and female patients. So I think the conclusion here is that, we can see vitamin C and topical insulin combined with microneedling achieving a significant improvement in acne scarring. So that is a important potential addition to traditional microneedling therapy alone. However, the work on insulin needs to be further delineated so that we can kind of figure out how to more precisely and better use this possible novel agent to improve acne scarring.
And our last study for today is a split-face comparison of the efficacy and safety of a topical triple combination of tranexamic acid, oxymetazoline, and brimonidine tartrate versus placebo in the treatment of post-acne erythema. Dr. Yadav, what did you think about the findings of this study?
So this novel agent combines a number of agents that we know to help with erythema in other skin conditions. Topical brimonidine is been used for the treatment of persistent facial erythema and rosacea. So combining it with these other medications certainly makes sense from a mechanistic perspective. In this study, the treatment lasted about 3 months, and there was significant effect in diminishing post-acne erythema compared to the topical placebo side in this split-face study. Again, I often think about the value of these topical therapies in terms of their short-term and long-term benefit. I think post-acne erythema, a large portion of it is short-term. And so in that way, a topical treatment may be helpful in riding people through that difficult phase of healing from their acne scars once you've successfully managed or treated acne. But for some people, the erythema is persistent. And so just like we do in rosacea, I think that there's a role to play for topical brimonidine as an reducer of facial erythema, but it is temporary. And for my patients who have rosacea and also in my acne patients who have post-acne erythema, I do recommend laser treatments often as a more durable solution where the gains are also much more natural looking. And so I think we'd have to see a little bit more about how this plays out in a clinical real world experience, but it certainly is exciting to have an option because there really is nothing right now that is topical for post-acne erythema. To get another perspective on today's topic, we reached out to Dr. Geeta Ahluwalia. Dr. Ahluwalia is the lead dermatologist at the Canadian Dermatology Centre in Toronto. She offers a wide range of treatments in her practice and also engages in clinical trial work. She has presented at national and international meetings and is a lecturer at the University of Toronto. Dr. Ahluwalia, what's been your experience managing post-acne sequelae?
It's an important topic to address. I think the first thing is that we have to treat acne aggressively. I see it so many times where people come in with scarring, severe acne, nodule cysts, and they're reluctant to go on aggressive treatment. The longer you wait, the more the sequelae, the more the scarring, the more the post-inflammatory pigmentation. The second point that I think is really important, and I drive it home with each of my patients, is that sun protection is an absolute must. This will help a lot with the post-inflammatory pigmentation and the post-inflammatory erythema. And the third and final thing to consider is to be proactive about treating the scarring. Whether it's chemical peels like Jesner's peels that are going to both target pigmentation and work on the scarring and the active acne, or laser treatments if they still have active acne. Along with it, you can do treatments like laser genesis, which are bulk ND egg heating under the skin to make the acne less and the scarring less. And once the acne is clear, I often suggest that my patients do other treatments to improve their skin, such as radiofrequency microneedling, and in fairer skin types, sometimes CO2 laser. So the three take-home things are to treat the active acne aggressively, sun protection, and being proactive about scarring with in-office procedures.
Now for our acne myths and trends. This first comes from Isabella Ross on TikTok. She says that placing a slice of raw potato on her cystic acne overnight brought the swelling and inflammation down. What are your thoughts on that?
I wonder if it was a cold potato. We've seen a lot of over-the-counter treatments that involve cooling of the face to reduce inflammation. So cold cucumbers, cold spoons. I don't know about the mechanism of using a potato in this context specifically, but certainly swelling and inflammation will respond temporarily to cooling in terms of reducing the visibility of it. But again, these effects are temporary and quite short-lived and short-lasting. I think real treatment requires a little bit more of an evidence-based sort of approach.
Kalkalthan on TikTok is one of several individuals who say that applying anti-dandruff shampoo to their face can help clear acne. What would you say to that?
I have had patients come into my clinic over the last year or two, I've noticed, asking me about what they describe as fungal acne. And this is a term that's kind of been circulating around in the lay literature for some reason. And it's the notion that possibly, we've seen this, that you can have a folliculitis induced by a pittosporum or a yeast. It is possible, but I think what I would say is that is the diagnosis correct, first of all, because it may be that this patient actually had a component of seborrheic dermatitis on their face, and that's why the anti-dandruff shampoo works. We use anti-dandruff shampoos for the treatment of seborrheic dermatitis on the face that can cause redness and scaling. But in terms of clearing the acne as we kind of traditionally think about it, that wouldn't be one of my, first line treatments. But I think I would also be remiss if I didn't add that some conditions do go together. And actually, I see a lot of seborrheic dermatitis in combination with rosacea, and rosacea is often mistaken for acne. So, it may be that this TikToker found some benefit from using an anti-dandruff shampoo, but it might be for different reasons than what they think.
And last myth for today, Brittany Xavier on TikTok suggests that baking soda paste can be used as a face wash or an overnight spot treatment for acne. What are your thoughts on that approach?
Baking soda for acne has been an over-the-counter home remedy, do-it-yourself kind of acne treatment that's been discussed for a while. And it sort of often recirculates, probably because of its ease of use and access. I don't think that I would put it high up on the list as a solution for acne, but baking soda does have some benefits. Its slightly gritty texture means that it can have a somewhat exfoliating effect. There are some anti-inflammatory properties to baking soda, but I think more worrisome is that baking soda is very alkaline. So it has a pH of about 9, and it can actually very much irritate the skin, causing inflammation and dryness. And so it wouldn't be high up on the list from an efficacy point of view. It is probably not even high up on the list for an over-the-counter or do-it-yourself point of view. But there is some thinking around how it could be somewhat helpful. But I think it's very important that how it's used and applied so that it doesn't irritate the skin and isn't used very often is important to kind of put into that context.
Thank you, Dr. Yadav. Listeners, if you have comments or questions for Dr. Yadav, send them over. Send an email to health@chronicle.org and add a voice clip attachment to your questions, and you might appear in a future episode of this podcast. If you enjoyed this podcast, please share it with your colleagues. You can subscribe at Apple iTunes, Google Podcasts, Stitcher, or wherever you get your podcasts. This podcast was produced in cooperation with Cipher Pharmaceuticals Incorporated. I'm John Evans, Senior Editor at Chronicle Companies. Your host has been Dr. Geeta Yadav, Founder and Director of Skin Science Dermatology in Toronto, and a general medical and cosmetic dermatologist. Thank you for listening to the Yadav on Acne podcast. We look forward to speaking with you in future podcasts.